Which of the following is the most likely diagnosis? Brenner tumor, dysgerminoma, granulosa cell tumor, Kronenberg tumor, or Sertoli-Leydig cell tumor? A 36-year-old woman presents to the clinic with complaints of heavy menstrual bleeding and pelvic pain. Physical examination reveals an enlarged ovary. Ultrasound shows a solid ovarian mass, and subsequent laboratory tests reveal elevated levels of inhibin and estrogen. Which of the following is the most likely diagnosis? I know just because it's already in the ovary, Brenner tumor is in the bladder, and Kronenberg tumor is in the colon or stomach, one of those two. So I'm gonna go ahead and get rid of Brenner tumor and Kronenberg tumor. Dysgerminoma, I think of as increased LDH and HCG, or not HCG, one of those two, LDH and HCG. So I'm gonna go ahead and get rid of dysgerminoma. Elevated levels of inhibin is from FSH, and estrogen is from obviously no wait. Estrogen is from the ovaries. Okay. Here's where I get lost. Sertoli-Leydig and granulosa cell tumor. Man.
You're on the right track, I'll tell you that.
It's just I come down to it.
I guess my question to you is, do you remember which one secretes what? That's going to be your key.
I know FSH secretes. I'm actually leaning. So I think Sertoli cells secrete FSH, or like they mess with FSH. So I'm gonna go with that. It's just leaving my mind.
Which one are you going with again?
Sertoli-Leydig is what I'd probably go with.
Okay. Final answer.
I'll probably keep it. Yes.
Okay, this is actually granulosa cell tumor. That's okay. No, this is the best way I can help you remember that. Okay, so granulosa cell tumors, it secretes estrogen. Okay, that's what you got to know. Okay, how do I and remember, what does estrogen do to the uterus?
So it's going to build up the uterus and get ready for implantation if for implantation if it needs to, if it's ready.
Okay. Okay, good. So when you bleed, are you going to have heavier bleeds or lighter bleeds?
If you have you're going to have heavier bleeds if you have increased estrogen.
Yeah. So that's why granulosa cell tumors, they're going to have really, really heavy bleeds, right?
Okay.
Let's talk about this. So if you have a granulosa cell tumor in the ovary, what kind of uterine cancer does it increase your risk of?
Say it again.
If you have a granulosa cell tumor, right, in the ovary, of course, right, that secretes all this estrogen, what kind of cancer does it increase your chance of getting in the uterus? If that makes sense.
I really don't know.
Yeah, so endometrial cancer, right?
Oh yes, endometrial. Yes, I did know that.
Yeah, because you're building that layer up. You're building that layer up, right? You're causing endometrial hyperplasia, right, which can eventually turn to endometrial carcinoma, right? So sometimes they'll ask you that. It's a good question to ask because they'll say, oh yeah, you have this tumor in the ovary, okay, and then if you don't treat it, what can happen? And they'll give you a bunch of cancers, right?
Okay, they'll just say like there's a tumor they found, for example, they can say like there's a tumor they found and it's increasing increased levels of estrogen. Like what other like finding, I guess, in the future, if left untreated, would be most likely to occur? It would be endometrial carcinoma.
Yep. So those are kind of some high yield things about granulosa cell tumors. Sertoli-Leydig cell tumors, those are going to secrete what? Do you remember?
I don't.
So those should, if I remember correctly, should secrete like testosterone. Okay.
Yeah.
So androgens or testosterone. So actually complete opposites of each other. So which is good because that's how you want to learn these things, right? These two are opposite of each other. Granulosa cell tumors equals estrogen, right? Let me write this out. Maybe if it lets me. Okay. I'm going to just abbreviate because my handwriting's bad, as you already know. So E for estrogen. Okay. And this is for T for testosterone. Okay. And so if a woman has a Sertoli-Leydig cell tumor, and this can happen in kids too, if you have that, then you're going to have, hirsutism, right? They're going to say, oh yeah, and a lot of facial hair, body hair, etc. Okay.
Which makes sense because Leydig does interact with testosterone a lot.
Exactly.
Yeah.
Exactly.